Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Dr. Brad Kristoff and Brittany Bond, both with the Helping Hands Clinic. Welcome.
Thank you for having us today, Paige.
Thank you for being back. And I'm just going to ask you, tell us who you have as your guest today.
Well, I've brought with me today Dr. Brad Kristoff. He is the medical director for Helping Hands Clinic and a provider with UNC Health System. And I'll let him tell you a little bit more about himself.
Okay.
So.
Sure. So I've been working with UNC in Caldwell for about 2, going on 3 years now. I've been in and out of the Carolinas off and on for about 10 or 11. So I'm happy to be back in North Carolina and calling it home. I do work full-time at Caldwell, but I volunteer to work at Helping Hands where I can. And I'm also a student at App State working on an MBA, so go App.
Go Nears.
Well, you just gained us a lot of viewers with the Go App statement because a lot of Appalachian graduates here in Caldwell County. So you said you've been in and out of the Carolinas. Tell us where you're from originally.
Sure, originally from Cincinnati, Ohio, so I'm originally a northerner, but I went to undergrad in Furman University in Greenville, South Carolina. I did my medical degree in Campbell, so out in Bowie's Creek in the eastern part of the state, and back now in the western part of North Carolina and hoping to be here for a very long time.
Good. As medical director, explain what that means for our viewers.
Absolutely. So I think most viewers are going to know what a doctor does.
Right.
There's different specialties and their job's a little bit different, but a director is more over the medical decisions a clinic has to make. So there's more than just seeing patients. There's a lot of decisions that have to be made about what kind of care can be offered in a clinic. How to manage referrals and specialists, how to coordinate care between different groups. Helping Hands is a primary care clinic, so there's a lot more that goes on in the clinic than just treating patients.
You said primary care clinic.
Yeah.
Let's talk about primary care. For those who don't know, what is primary care?
Sure, great question. So primary care, and I'm going to give you a vague explanation, I'm going to break it down a little bit. So primary care is really a range of health services that are focused on your total health care needs. It's diagnosing and treating things. If you've got a sore throat, a primary care provider could diagnose you with strep, treat with an antibiotic. They also might diagnose chronic conditions, hypertension, diabetes, heart disease. But it's more than just diagnosing and treating conditions. It's also about health promotion, health maintenance, and disease prevention. So some people might say, well, Doc, if I feel good, why do I need to see a doctor? I'm healthy, right? Well, that's where those other concepts come into play. So one of them, health promotion. Hey, how can you be the best version of yourself? I'll give you an example. Folks will come to me and say, Doc, I've got these grandkids and they are just a handful. I would love to be able to keep up with them, but I'm just so worn out at the end of the day. Well, now I expect that with grandkids. But sometimes we need to talk about a diet and exercise regimen to help people gain some extra stamina so that they can keep up with their family members. Health promotion is really about keeping you doing what you want to do. Same with health maintenance. So a lot of people might be healthy and think, I don't need a doctor. I walk 5 miles a day and I eat a great diet. Well, excellent. Let's keep you healthy. Because unfortunately, we all will age, if we're lucky. But how do I keep you doing the things you want to do for the rest of your life? That's health maintenance. That's an important part of primary care. And finally, the last part is disease prevention. It's so much easier to manage conditions if you don't have them at all. So one of the most common presentations people will come to me with diabetes is tingling in their feet. And that's not something people necessarily think of with diabetes. But that's a condition called diabetic neuropathy, or nerve disease. And it's irreversible. So when folks start coming to me with that, I can't do anything to fix it. I can treat the symptoms. But it's so important if we can get you in before that condition develops to identify that disease and help prevent it before you become diabetic and develop those complications.
Exactly.
Brittany, at Helping Hands, talk about the role primary care plays, because you are a primary care clinic.
Yes. Our goal is to be the medical home for our patients, and Helping Hands Clinic specifically serves folks who don't have insurance, who don't have access to Medicare and Medicaid, and our in the lower income bracket. So folks who would otherwise probably not go to the doctor unless they had a crisis. That's the population that we are there to help. So our providers that are at the clinic provide primary care. They also do a lot of chronic disease management at the clinic, because unfortunately a lot of people don't come to us or connect to Helping Hands until either they have unmanaged symptoms. I think something like a third of our patients have type 2 diabetes, or until they end up in the ER and they come and see us for follow-up after a visit to the ER. So if we can encourage people to be proactive and to access primary care before you have an emergency, and to have a medical home to help, improve your wellness before you get into a situation where you're not well, then that's what we want to let the community know that we're here to do. So.
And you may have already answered this, but I want to reinforce it. Why is it so important to have that medical home?
Well, I would say that it is to make sure that you not only have access to health care when you have an emergency, but also to manage your needs ahead of time, and to be in a lot of our patients that we see at Helping Hands, at least, and I know a lot of adults in general who are well and healthy, kind of like what Dr. Kristoff was saying, don't access health care unless they have to. So being able to come to the doctor, to have your well checks and to have your annual physicals and do your blood work and have access to those things will keep you from getting into a situation where your symptoms are out of control and you have diabetic neuropathy, or you have another, incurable condition. Yeah, we can treat your symptoms, but you're going to have to live with this now. So that is something that's really important for folks in this community and all communities to know, because studies have shown that accessing primary care improves your health and your wellness and increases your life and your lifespan. So that's something that is important for us to share with the community, and something that we're really proud to be able to do for our patients.
One of the things I'm hearing is, even if you do come in for an emergency, brings you into the clinic for your first time, that follow-up appointment and those subsequent follow-up appointments are very important.
Yes.
How do you encourage people to keep those appointments?
Well, at Helping Hands, often those follow-up appointments come with the need for ongoing prescription medications and monitoring of those medications and adjustments. So a lot of our patients come and see us fairly frequently to monitor their medications, to have their blood work done, a lot of which we can do in-house, though the services that we can't provide in-house. So we can provide primary care, most labs, and some other, specialty services on site. But we have a partnership with UNC Health in which all of the patients who come to Helping Hands and are enrolled as a Helping Hands patient are duly enrolled into UNC's Charity Care program. So services that we can't offer on site at the clinic can be offered through UNC services at a really low cost, a really affordable cost. So patients can come in and have those things taken care of, and then have access to the things that they can't have in the clinic on site, if that makes sense.
So really just providing care for the uninsured.
Yeah.
Which is always grateful. Dr. Kristoff, what brought you to Helping Hands? I mean, what drew you there?
Absolutely. It's such an important need that Helping Hands serves. We get into medicine because we want to help people. I mean, every doctor is going to tell you that, right? And unfortunately, those without insurance are sometimes the most in need in the population. And I love it here in Caldwell. Like I said, I'd like to stay for a long time. And this was a way for me to kind of give back to the community and support where I can in a population that really needs it. And actually, I kind of wanted to follow up on one of your previous questions, if you don't mind.
Sure.
So you asked, why a medical home, and why come back to those next visits? From a clinical side, a lot of what I do with folks is goal setting. What are your goals for your health? That way, it's not always about your blood pressure, your sugars, but what do you want to do with your life? What kind of life do you want to live? And let's talk about how to get you there. And I use that as the focus of, here's why you come back, to make sure we're meeting your health care needs, your goals. And that's a very important part of primary care.
Yeah, very good. Okay, have I forgotten anything as we've talked today? Anything else we need to cover?
Just that I would encourage folks, especially the folks in this community who who maybe don't have insurance right now or don't have access to the health care that they need to reach out to us at Helping Hands. Something like half of our patients right now are employed and working in positions where they don't have access to insurance. So we can also help those folks stay healthy and get to work. And we try to work around and create appointment times that are available that work with people's schedules. So we just want folks to know that we're here as a resource and that we can help them with their primary care needs and also with their medications and other specialty needs that they have for their health care.
How do people reach out to Helping Hands?
I would recommend that folks give us a call, and I think that we can put our number
We
on
can
the
put the
screen.
number on the screen.
So I would recommend that you call and have a pre-screening conversation to make sure that you're eligible for care, because if someone calls us and for some reason isn't eligible for services at the clinic, we can help navigate them to other resources that can meet their needs.
Sure. Dr. Kristoff, Brittany, thank you for being here today, and thank you for what you're doing for the health of our community.
Thank you.
Thanks, Paige.
And thank you for watching Caldwell County Today.